What a tricky question to answer. Let's break this down. My name is Yosha. I'm a medical student and I've been helping aspiring medical and dental students with their interviews for coming up to 4 years now. This is an NHS or current affairs focused question which can come up very commonly in MMIs or multiple mini interviews, and I've done another video to break down what the different interview structures are. To answer this well, you need to have an understanding of how funding for the NHS works, and I suggest using credible, wider reading websites like the King's Fund, from where I got this statistic. What this figure tells us is that £1 million is actually nowhere near the amount of money that we understand it to be when it comes to budgeting for the NHS. Stay away from answers that involve interventions or long-term clinical trials, such as finding cures for diseases, because this is not only time intensive but cost intensive, especially because many people have to get involved and it takes years to develop a new drug or conduct these trials and get people to sign up. However, this sort of sum can be spent on beginning stages of trying to develop a new drug or therapy. And by beginning stages, I mean research and development, and maybe starting to get some publications out, some systematic reviews out in terms of whether it is a viable area to start finding a therapy or a drug for. I think about health education awareness campaigns, sort of preventative measures which are a little bit more cost efficient, and discuss opportunity costs. So think about the amount that you're investing maybe into a public health campaign, let's say raising awareness on the symptoms of endometriosis. Can you measure how successful that campaign would be and how many patients it may affect? Or by helping access early diagnoses, not only will this benefit the patients, which are at the core of what we do, but it may reduce the costs that happen later on down the line when conditions are diagnosed at a much later stage. Alternatively, maybe you could reinvest into the refurbishment of some equipment for a primary care centre or social care. I hope this helps.